Hi, Mr. Alvarez. My name is Michael. I'm one of the pharmacists here at Norwalk Hospital. Do you have a few moments to discuss your new medications?
Yes.
Okay, great. So the first medication that you're being started on is called Entresto. It contains two medications known as valsartan and sacubitril. So the dose is 24 milligrams of the valsartan and 26 milligrams of the sacubitril. It's in one tablet, and you'll be taking one tablet by mouth twice daily.
Okay.
So the use of Entresto is it's going to help prevent your heart from changing further and prevent progression of your heart failure. And studies have shown that Entresto reduces death associated with heart failure. Additionally, it will help with blood pressure control and decreases the workload of the heart, making it easier to pump blood throughout your body. Some side effects of Entresto include dizziness. You may experience cough, although it's less common with this drug. And another possibility is something called angioedema, where you may notice life-threatening swelling of your lips, tongue, throat, in which if you experience any of that, you should go to the emergency room or contact 911 for urgent treatment.
Can I take it any time during the day, or it really doesn't matter?
So ideally, you'll take it once in the morning and once in the evening. So if it helps you to remember to take it with breakfast and then before you go to bed, that's one way that you could do it.
Okay.
But with Entresto, it doesn't have to be taken with food. You could take it irrespective of a meal, but ideally once in the morning and once in the evening.
Okay.
That was a really good question, Mr. Alvarez. So the next medication that you're being started on is called carvedilol or Coreg, 3.125 milligrams by mouth twice daily. Similar to the Entresto, you'll want to take this once in the morning and once in the evening. But unlike the Entresto, Coreg or carvedilol should be taken with food. So you could take it with breakfast in the morning, and then you could take the other dose with dinner at night if that helps you remember it and to take it with food.
Okay.
So this medication, carvedilol, is used to prevent the progression of your heart failure. It also does have the additional benefits of reducing blood pressure and heart rate, and reducing the amount of work your heart has to do to pump blood throughout your body. And studies have also shown that carvedilol or Coreg can extend the life of patients with heart failure. Some side effects of this medication can cause a low heart rate, can make you feel tired or sleepy or fatigued, but usually that goes away with time as you'll build a tolerance to it. And it's also really important with this medication to not stop taking it abruptly. If you have to stop taking this medication for some reason, your doctor will create a plan for you to come off this medication in a safe way.
Okay.
Okay?
Yes.
The next medication that you'll be taking, and the last one for your heart failure, is called furosemide or Lasix. You'll be taking 40 milligrams by mouth twice daily. For the timing of these doses, it's important to take the first dose in the morning, and then the second dose ideally take before 5 p.m. So that you don't have to be running to the bathroom in the evening, as this is a water pill or a diuretic and will cause your body to excrete additional fluids through urination.
That's a really good point, because I do not want to be out of bed in the dead of night just to pee multiple times.
Absolutely. Some patients will take their furosemide later in the day, and then they'll often complain about having to wake up frequently throughout the night to urinate and go to the bathroom, and then they won't get a restful night's sleep. So it's important to take that medication a little earlier in the day to prevent that. And additionally, with this medication, it's important to weigh yourself daily, because this medication is removing fluid from your body that isn't supposed to be there. So by weighing yourself daily, it lets us know and lets you know if there is fluid accumulating or building up in your body.
Okay.
So you should call your doctor if you notice that you have a weight gain of 2 to 3 pounds within a 24-hour period, or if you notice a weight gain of 5 or more pounds within a 1-week time span. Because that could indicate that you're holding on to too much water, and your doctor may have to give you an additional medication or increase the dose of your furosemide or Lasix to make sure that you're getting rid of that water.
Okay.
All right. And one last point about the furosemide or Lasix is try to limit your fluid intake to 9 8-ounce cups a day, because we're trying to get the water out of your body. You don't want to be putting too much water back in it, because your body is having a hard time getting rid of it. All right?
Okay. Thank you.
Of course. It's also important to stay as active as possible. Without exercise, your heart will continue to get weaker, Exercise is known to be really beneficial for people's hearts. So be sure to talk to your doctor about an appropriate exercise regimen that's appropriate for you.
Okay.
All right. And lastly, controlling your heart failure has many benefits. It can prevent your heart failure from progressing. It can decrease your ability to stay active, the need for more oxygen. It can cause your legs swelling, lower leg swelling, also known as edema, and can overall decrease your quality of life. So it's important to take your medication as prescribed, and to try to reduce your salt intake and fluid intake as well. Okay. And what questions do you have for me, Mr. Alvarez?
So I know with some of these medications, you stated that I could take them twice weekly. I think all of them were twice weekly, you said? I'm sorry, twice daily.
Yes, so they're all twice daily. The Entresto, or valsartan sacubitril, the furosemide or Lasix, and the carvedilol or Coreg are all twice daily medications. The Coreg is the only one that you'll have to take with food. You can take the Entresto at the same time as the Coreg, but with the Lasix or furosemide, it's recommended to take your last or second dose of the day a little earlier, maybe earlier around 5 p.m., so that you're not urinating throughout the night.
Okay.
I just want to make sure I reviewed all the information with you, and that I made sure that your understanding of everything. Would you just be able to tell me how you're going to be taking your new medications?
Okay, so I know you stated that there are 3 medications, and these are for my heart failure. One of them was Entresto, the other was, I think you said it's something called Lasix?
Yes, Lasix.
And then finally Coreg or something with rag.
Yep.
And then with these medications, you said I should be taking them twice daily.
Mm-hmm.
With the Lasix, I believe you said I'm taking that with food.
That's with the carvedilol
Okay.
or Coreg. With furosemide or Entresto, you could take that irrespective of meals.
Okay. So with these medications as well, you said to store them in a dry place. So definitely not in my bathroom.
Yep.
Although that's where I keep most of my medications. So I'll just take all those medications out.
Great.
And I think that's it.
Yeah. I just want to highlight again the Lasix, your second dose of Lasix. You may want to take a little earlier in the day, maybe around 5 p.m., just so you're not urinating throughout the night, and you'll be able to get a good night's rest.
Okay. Thank you very much.
All right. And if you have any other questions, if you think of anything else, feel free to contact me or your doctor.
Thank you.
All right. Thank you for your time, Mr. Alvarez. Take
Thanks.
care.